Everyone has seen the ads, right? Shiny smiles, confident promises, and that bold name everywhere. ClearChoice Dentistry. But here's the question nobody asks out loud. What actually happens behind the scenes of those dental implant consultations? Are you getting the full story, or just the highlight reel? Today, we are pulling back the curtain. Dr. Esma is here with me, and we are diving into what patients often wish they had known before saying yes. If you have ever considered implants, this is the episode you do not want to skip.
Rasim, I love that you said highlight reel. Dental implants can truly change lives, but the consultation process, the evaluation criteria, the long-term planning, these details matter more than the marketing. Not every smile is a simple case, and not every patient hears about bone density, healing timelines, or maintenance expectations up front.
So stay with us, because in the next few minutes, you might discover the one question that changes everything before your first appointment. Let me paint a picture, Dr. Esma. Someone walks into a sleek office, hears a confident presentation, sees impressive before and after photos, and feels hopeful. They are told they are a great candidate for implants, but a few weeks later, they discover there are extra procedures, longer healing times, and lifestyle changes they never expected. That is where the frustration starts, right?
Exactly, Rasim. Many patients focus on the final smile but overlook the medical foundation. Bone quality, gum health, and medical history all influence outcomes. If those are not discussed clearly, expectations and reality can clash. Implants are not just cosmetic, they are surgical procedures that require planning and patience.
And that clash can feel overwhelming, because once you are emotionally committed, it is harder to step back and ask deeper questions. So why does this really matter, Dr. Esma? I mean, if the end result is a beautiful smile, some people might think the journey details are just technicalities. But I have heard stories where patients expected a quick fix and ended up facing months of healing, temporary teeth, and multiple visits. That gap between expectation and reality can shake your confidence fast.
It matters because implants are a long-term commitment, Rasim. Imagine a patient with low bone density who needs grafting but does not fully understand the timeline. Or someone with untreated gum disease expecting immediate placement. Without clarity, disappointment can follow even if the procedure is technically successful.
So the real secret is not just the implant itself, it is understanding the roadmap before you ever sit in that surgical chair. Dr. Esma, give us some context. Dental implants are not new, right? They have been around for decades, yet people still walk in thinking it is a same-day miracle for everyone. I recently read that implant success rates are high, often above 90%, but that number depends heavily on proper case selection and planning. That is a big detail most ads skip.
You are absolutely right, Rasim. I had a patient in his early 60s who assumed he could receive implants immediately after extraction. After proper imaging, we discovered significant bone loss. We created a staged plan with grafting first and placement months later. Because we respected biology, his outcome was stable and strong.
So the stat sounds impressive, but the strategy behind it is what truly protects the patient. Alright, Dr. Esma, let us zoom in on the science for a second. People hear the word titanium and think problem solved. But implants are not screws in wood. They are living integrations with bone. What is actually happening under the surface after placement?
Great question, Rasim. The key process is osseointegration. That means the bone cells grow and attach directly to the implant surface. It takes time and depends on blood supply, bone density, and overall health. If someone smokes heavily or has uncontrolled diabetes, healing can be slower and risk increases.
So it is less about instant transformation and more about biology doing its quiet, patient work. Alright, Dr. Esma, let us make this practical. If someone is considering implants, what is the smart, step-by-step approach so they do not feel blindsided later?
First, Rasim, start with a comprehensive consultation, not just a quick scan. Share your full medical history and lifestyle habits. Second, request detailed imaging like a 3D scan to evaluate bone quality. Third, ask for a written treatment roadmap that outlines phases, healing periods, and maintenance expectations. Finally, discuss long-term care. Implants require hygiene discipline and regular follow-ups. When patients understand each step clearly, confidence replaces anxiety.
So it is not about rushing into surgery. It is about building clarity, one informed step at a time. Okay, Dr. Esma, let us talk real-world cautions. If someone is sitting at home researching implants tonight, what are the biggest do and do not rules they should keep in mind before booking anything?
First, do not choose based only on marketing or convenience. Do ask about the clinician's training and experience with complex cases. Do not ignore warning signs like untreated gum disease or smoking habits. Do prioritize a second opinion if the plan feels rushed, and never skip the discussion about maintenance, because implants can fail without proper hygiene and follow-up care.
So the golden rule is simple. Be curious, be cautious, and never be pressured into a decision about your own biology.